So that was my initial contact. From there, because Wellness Foundation has had this incredible um, lineup of advisory council members. Our medical director was Dr. Furman. There was Dr. Caldwell Esselstyn, Dr. Barnard, Dr. Campbell. There was just so rich in knowledge and experience there.
You're listening to the Plant-Based Eating for Health podcast show. I'm your host, Kathleen Gage. We're here to plant seeds on compassion to animals, your health, and the environment, and topics related to business that align with all three of those areas. Enjoy the show. Well, I am super excited. Today, I have an amazing guest who is an expert in helping people reverse diabetes, exercise physiology, especially as we get older, and just an amazing woman all the way around. She's got a master's degree in exercise physiology and plant-based nutrition, I believe, but she'll correct me if I'm wrong. I'm Kathleen Gage, by the way. I am the host of Plant-Based Eating for Health podcast show, and I'm here with Peggy Kraus. Peggy, great to meet you, or great to see you, I should say.
It's great to be here, Kathleen. Thank you for having me on.
You betcha. Let's start with your whole journey into plant-based eating, because, I actually was just communicating with somebody on LinkedIn who is plant-based, and she says, oh, it's so hard. I just don't know what to do. And it's like, not really, if you know what to do. So let's start with how you got started and then come up with some strategies on how people can actually incorporate that into their life.
Sure. Yeah. I mean, my introduction to plant-based living goes back to 2005. So there was not much help out there for somebody who didn't want to eat animal products anymore. So in 2005, I gave sort of an informal lecture at a local school on Morgan Spurlock's Supersize Me. And after the presentation, this gentleman came up to me and he introduced himself and he told me what his foundation did. And it was a little, I hadn't heard of plant-based eating before. So Wellness Foundation was his foundation, was his nonprofit foundation. And the mission of Wellness Foundation was to introduce the community to plant-based eating and to help them to implement it into their lives. So that was my initial contact. From there, because Wellness Foundation has had this incredible lineup of advisory council members. Our medical director was Dr. Furman. There was Dr. Caldwell Esselstyn, Dr. Barnard, Dr. Campbell. There was just so rich in knowledge and experience there. So because of that, I was able to meet the big ones. I met Dr. Furman. I had conversations with these doctors about issues around plant-based. Anyway, so I went from sort of a non-believer. I mean, I have a master's degree from NYU, and I had never heard of a plant-based. I had never heard that milk was not good for me. That's what Dr. Furman had told me the first time I went to see any of these lectures. And I thought, I didn't know that. Like that, where did he get that from? So I started to do the research myself. And then I went to hear Dr. Caldwell Esselstyn tell us about meat and dairy. So it just started to piece together. And my thing is that once I know something, I can't ignore it. I can't just pretend it doesn't exist. So because of I did after a year or two start working with Wellness Foundation. So I had even closer contact with these doctors, these specialists, these experts. And it just grew from there. So my working with Wellness Foundation, 15 years or so until we had to close our door because it was hard to raise money during COVID.
Right.
But we did in community events, and I did we ran this program. It was called Wellness Challenge. So it was a 7-week program, 7-week challenge for somebody to give up animal products and processed foods altogether. So people use it sort of as a jump start to healthier eating. But we did that in the community for 12 years, and then COVID hit, and we created a new program online called Jumpstart 360, and yeah, and then from there, or I should say, as I was doing that, I had this interest in diabetes, and I'll tell you more about that in a bit. But just that I created a program called Erasing Diabetes, and I took that into primary care. So I worked in a doctor's office for 10 years, and the whole reimbursement model was really a problem for me, because I was doing the same charting and data collection and billing that like a brain surgeon does.
Right.
And I'm telling people to eat more fruits and vegetables, and still so it was a problem. So I left primary care just earlier this year, and I started to create my own, so far, online programs. But I really hope that I can bring them out into the community and scale them and hire people to teach the programs.
Well, and one way to do that is to get on podcast shows, without a doubt. I mean, when you consider the reach, I remember working with a client a few years ago who had never been on a podcast show before. And I teach people how to get on podcast shows. And she got on her first show, and I said, "So how did it go?" And she goes, "Well, they got 48,000 downloads in 2 days. Is that good?" And I'm like, 48,000 in 2 days? That's incredible. And I said, "Now, I don't want to burst your bubble, but don't anticipate that that's how every show is going to be," because that was kind of just a freaky situation. But yeah, podcast, definitely a way to get your message out. Now, I want to take a step back with when you were doing the fast track and the 7-week program. And you said once you learned and you found out, you couldn't go back. And yet so many people, they've heard of the atrocities of what happens to the animals and what happens to our body. I mean, every time I go to the grocery store, I have to say that I'm very hopeful for myself, because I'm in a position where I can buy just about whatever I want. And I buy very healthy foods. My cart is filled with fruits and vegetables, beans, legumes, the whole 9 yards. And yet I will pull my own covers. I've gone through periods where I become a junk food vegan. And that's an issue that I really have to look at and say, okay, what are you doing that for? But as people are out there and they get this information and they choose to ignore it, and they get sicker and sicker and sicker. And you said the reimbursement, that was an issue. The healthcare system is really a sick care situation more than a healthcare. What do you recommend to people who just fight this and they say, "Oh, tomorrow I'll start, and I'll eat healthy next month"? What can you say to, if you will, inspire people to really look at what they're doing to their bodies, to the animals, and to the environment? And some people could care less about the animals. Some people could care less about the environment. So let's talk about our bodies.
So it amazes me how somebody can say, "Oh yeah, I was diagnosed with breast cancer, and now I'm going to eat healthy," or "I had a stent and now I'm going to stop eating ice cream." Like, why are we waiting? Why don't we do it now? Let's do it now. Pretend this day is that day, right? But still, people have sort of they're not ready to give up. I struggle with the same as you, Kathleen, but what I find is helpful is to start with one thing.
Okay, let me stop you there. When you say you struggle with the same thing, is that vegan junk food, or wondering why people don't jump on board? Let's clarify that.
Yeah. Well, there are some vegan junk foods that I like. I enjoy it, but yeah. But yeah, I don't get why it's not that hard. It's really not that hard. So my thing is, I like to make it simple. So start with one thing. I tell my patients in cardiac rehab, start with breakfast. Get rid of the eggs, get rid of the whatever you're eating, the bacon, the bagels with cream cheese, oatmeal. Do you like oatmeal? Oh yeah, I love oatmeal. Well, why don't you eat it? It's so healthy. So start with one thing. And then I find that if people um, as people sort of lean into it, well, what can I do? What's the next thing I can do? Like, that wasn't so hard. What's the next thing I can do? Salads every day. Make the salad the meal, like Dr. Furman would say. Make the salad the meal, add some nuts, put some balsamic vinegar on it. Make that your lunch. It's not that difficult. Um, yeah, and then to keep a list. So when I changed my diet back in 2007, it was when I
Mhm.
changed my diet. I had this schedule, what I called it, that Mondays I work all day at the
Mhm.
hospital. So for
Mhm.
me to have something ready to go was easy. So it was Mexican Mondays. If I had a can of black beans and some taco shells and some corn and some lime and salsa, I had dinner, right? So it took away all the other possibilities because there's so many things. Should I make pasta? Should I make tofu? Should I make, there's so many things, but that was my guideline. Mexican Mondays. Italian Tuesdays, right? Italian Tuesdays, whether I had pasta or some sort of ravioli, this plant-based ravioli, this plant-based tortellini,
Mhm. Mhm.
a lot of Italian things that you can make, eggplant and soup and salad Wednesdays, leftover Thursdays. Fridays was always takeout. It was usually either a vegetable pizza or it was steamed broccoli with brown rice from the Chinese place. So there were options, but it was always, generally takeout Fridays. And then Saturdays and Sundays, I had time to make new recipes.
Right, right.
Some of the times they were good. Sometimes they were great, but sometimes they were awful. You know,
I have to say that since I started cooking plant-based, I never used to cook. I had a marriage when I was younger where no matter what I cooked, it was never good enough. And so I carried that into my adult life of like, I'm not cooking for anybody. And when I became plant-based, I started exploring and experimenting, and I found I love cooking now. It's kind of like an expression of love. But moving into, I want to talk about the whole health issue around when people are not eating healthy and they're choosing to put animal-based products and dairy products into their body. Let's talk about the whole issue with diabetes, because you have a big focus on diabetes. And it saddens me when I go to the grocery store and I see people that it really, now I can be judgmental. I try not to be. And so I say, God, please don't let me be judgmental. And then I seem to be more judgmental and I have to just work on that. But the fact is that I can look at people and I can see by what they have in their cart, what they're eating is a direct result of the excess 100 pounds they have. The reason that they're driving one of those motorized carts in the store, they're walking with a walker. And it saddens me to think that there is such an easy solution. And yet, we're up against the advertisers. Any evening of the week, you can watch TV and you can see probably 80% of the commercials are prescription drugs. Here's the next drug for the next disease. And that disease is a direct result of what we're putting into our body. So talk about how prevalent type 2 diabetes is. Is it really preventable? Is it reversible? Because most of us in the plant-based world have heard that yes, in fact, and we've talked to people who have reversed it, but people in the general public, they're like, oh, no, you have to take medication. So let's talk about that.
so yes, type 2, if somebody has genuine type 2 diabetes, that is totally reversible. That is a diet-driven disease.
Mm-hmm.
Exercise helps, stress management helps, sleep helps, lots of things help, but you have it because you have too much fat in your diet that has been stored in your muscles, and it goes other places also, but
Mm-hmm.
because it's in your muscle cells, that's why your blood sugars are elevated, right? So the simple fix is that if we can lower the fat in your diet, that intracellular lipid comes out of the muscle tissue, the numbers start to go down, you don't have type 2 diabetes anymore. So it is such a simple fix. There are a lot of nuances about it. So many things other than diet. Like I said, there's exercise and sleep and medications. And
Mm-hmm.
so it's
Mm-hmm.
not, for somebody who doesn't know that, it might not be so simple, but it
Right.
is reversible. So there are other types. So of course, we all know type 1 diabetes, where the pancreas is no longer making enough insulin.
Mm-hmm.
It's type 1.5 diabetes, where that's type 1 diabetes that's diagnosed in adulthood. So
Mm-hmm.
type 1 usually is juvenile diabetes. Um, Teens and younger are diagnosed with type 1.
Mm.
Much more easy, much more recognizable these days than it was maybe even 10 years ago.
Right.
But type 1.5 diabetes is something that I love. I love, I love. But that's when adults develop type 1 diabetes. And we can talk about more about that in a minute.
Absolutely.
Yeah, type 2 diabetes is, like I said, that's a food-borne illness, like Dr. McDougall would say. And then there's also conditional diabetes. There's MODY. There's other kinds of diabetes,
Mm-hmm.
but I'm not really so strong on those. It's the type 2 and the type 1.5 that are absolutely my love.
Okay, so there's the type 2, there's type 1, type 1.5, type 2, and now there's type 3. And I want to put in a pin in that for just a second to remind people that you're listening to the Plant-Based Eating for Health podcast show. I'm your host, Kathleen Gage, and I'm here with Peggy Kraus, and we're talking about reversible diabetes. It is, in fact, reversible. And so what's the difference between type 1, type 1.5, type 2, and now type 3?
So let's start with the ones the lower numbers. Type
Okay.
1.5. Okay, type 1.5 is when someone's pancreas. Okay, so if the pancreas is needed in the body, very important because it makes insulin. Insulin has lots of roles in the body,
Mm-hmm.
but its primary focus in diabetes is that it lowers blood sugar. So if the pancreas, for whatever reason, starts to give out or gives out suddenly, those blood sugar numbers go up and diabetes is diagnosed. It's just then a matter of figuring out which kind of diabetes that this person has.
Mm-hmm.
So type 1.5 diabetes is when a person's been diabetes free most of their life, hits somewhere near 30, 40 to 50 years old, depending how astute the doctor is and does testing and can pick up trends where those blood sugar numbers are going up. They might reach the point where all of a sudden now they're 50 years old and their blood sugar, their fasting blood sugar is 140. That's type 2 well, that's diabetes.
Mm-hmm.
And their A1C is, say, 8.2. Diabetes. Doctor will readily say, oh, you got type 2 diabetes. Here's metformin.
Right.
So that treatment will work for a little while. And eventually, though, the metformin, because initially the metformin sort of helps to lower the requirement for insulin. So the pancreas sort of gets a little breathing room. We call it the honeymoon period. But then after a while, that person needs, it could be like 3 or 6 months, 9 months, usually under a year. The person needs a second medication. And then 6 months later needs a third medication. And that's just not the progression of type 2 diabetes. I mean, we do know that it progresses if you don't fix it.
Right.
It will progress because the people who don't change their diet, it's just going to get worse. But in type 1.5, the glucose numbers don't rise because the person's getting, pardon the word, fatter, because the fat is moving into the cells.
Mm-hmm.
The person's pancreas is just getting more tired, more fatigued, and is not making enough insulin until finally the person has full-blown type 1 diabetes as an adult. So my first diabetes patient, who walked into my office and slender, he could have lost 10 pounds, 15 pounds, whatever. Sat down and I said to him, he didn't even say anything. And I said, I don't think you have type 2 diabetes. He's like, what? And he was a nervous Nelly.
Mhm.
So I said, but you know what? Because you've been diagnosed with type 2 diabetes, let's treat it as such. I said to him, we can go the American diabetes, right? I realize I'm going off on a tangent, but might as well get
No,
this
no,
out.
I love these tangents. It's like, yeah, let's go down the rabbit hole.
So we can do this the American diabetes way, in which case have some success lowering your blood sugar. But if you really want to get rid of this, like I said, he was a nervous Nelly, let's go the plant-based way.
Hmm. Hmm.
And so I told him what that meant. No animal products, no oil, no processed food. And he said, I'm in. He said, my brother's vegan, my sister-in-law close to vegan, I can do it. I wasn't asking him to be vegan. I was asking him to put aside those
Right.
foods, right? And we talked about exercise, we talked about stress. And then he got on the next plane, or the next day, he got on a plane to Milan, right? So we kept in touch and he was getting night sweats. So all of a sudden, let me step back. So now he's type 2 diabetic. He's on Januvia, which is actually a combination of two diabetes medications.
Mhm.
But I pulled away all of his high fat foods, all of his processed foods. So his pancreas had relief there, didn't have to pump out so much
Oh,
insulin, right? But it was still pumping out the insulin. And he was developing these night sweats because he had a much improved diet and exercise and still the metformin and the Janumet. And now his blood sugars were dropping. And that is one of the classic signs that your blood sugar is low overnight, is that you get these night sweats and these nightmares. And so from Milan, he was in touch with his doctor, and within 11 days, he was off of his diabetes medication. 11 days.
wow.
Oh, yep,
Let
exactly.
me ask a question about that because the concern I have is when people they listen to a show like this or they read a book and then they say I'm going to do it on my own. That is probably the biggest mistake they can make. They need a medical professional, somebody who knows what they're doing to help them to change their eating and to monitor their medication. Am I correct?
Thank you. Yes. He was sending me glucometer reports,
Mhm.
numbers for this glucometer. This is this. So I was on the numbers, and then I said to him, you gotta call your doctor because those medications are too strong. So you're right. For people who do it on their own, it's very risky because if those blood sugar numbers start going low,
Right.
and around 55 is your critical number, is that is when the brain and the spinal cord are not getting enough glucose, and you could slip into a diabetic coma.
Ooh,
And
ooh.
a little scary. I mean, there's warning signs before you get there. It's not going to happen like this. But if you're sleeping and your blood sugar is going low and you're not responding by waking up, you could have a big problem.
Right, right.
So
So make sure, for the people
that's a great
watching and
point.
listening, make sure that you do this medically supervised with somebody who is into the 6 pillars of lifestyle medicine, who's certified, if it's a doctor, that they do believe in plant-based eating, if it's somebody who's a certified nutritionist, that they understand all of this. And, I just really want to caution people, your best thinking got you where you're at with the type 2 diabetes. Your best thinking is not going to get you out of it. You need to be guided through this. So, Peggy, before I forget, where can people find you? What's the best URL? And I know we're going to talk about your new program that you're releasing. I will save that for later, but let's talk about where people can find you.
They can go to peggykraus.com. So PEGGYKRAUS.com. There's one S. So
Okay, and we'll make sure that it
peggykraus.com.
goes. Yeah, we'll put that in the show notes to make sure.
Right.
I'm curious. A lot of people they have a story they hold on to in life, and I've been in recovery for 40 years. I don't do any drugs, any alcohol because I had a real issue with it. But I had a story that went with that. It was like, what was I going to do without that? And I had to have people who guided me through to that first day of not having a drink, and then the second day and the third. Now it's 40 years later. People have stories that they hold on to with their health, with their medication, with the healthcare system, with commercials they see on TV. How prevalent is the whole issue of people holding on to a story, not only because of them, but because of their family? Because when we start changing, I saw this in recovery, when people would stop drinking, even though their families would say, you got to stop drinking, when they stopped, they became a different person. How prevalent is that with somebody's health when they start dropping the weight, they start feeling better about themselves, they start really taking care of themselves, that the family might sabotage them or friends might sabotage them? Let's talk about that a little bit.
That's a great point. So I usually say, this is your journey. Don't try to bring anybody else with you, because it's probably not going to go as quickly, as well, as efficiently. So this is time for you. You do what you learn. You do according to what you're learning. And if anybody asks, I follow the Dr. Doug Lisle principle.
Mm-hmm.
Well, it seems to be working for me. I stopped eating meat. Seems to be working. I'll see what happens. That usually kind of lets people off the hook and off the concern. Lowers their excitement a little bit, and
Mm-hmm. Mm-hmm.
and that you're not necessarily bashing what they're doing anymore. You're focusing on yourself, and the seams principle is a great one to adopt. Just this is what you're doing for yourself, and I'm happy to, if this is your husband who is not digging the new meals, cook his whatever it might take to keep him happy. When I started cooking plant-based, and my husband's a commercial fisherman, so, and of course, we did this steak every other Sunday, and fish and chicken, and all of a sudden I stopped cooking. He was like, "What is this?" I said, "Well, the way we're going to eat now." And he said, "Oh, it's one of your diets." I said, "No, no, no, no." I said, "We need to do this." So his exact words were, "I need something that's going to stick to my bones." Right? But now fast forward 17 years, or actually it happened many years ago. He's a little older than I am. His friends started dropping like flies.
Mm-hmm.
This one needed a stent, that one cancer, that's when they open their eyes. So, but yeah, it's a sort of, but for a while, I was being a little bit more tolerant of the fish that he would bring home,
Right.
and other things. I had two young boys at the time. I remember Lucas standing on the dining room table screaming, "Why is everything to be so healthy?" Well, now he's vegan. He's full-blown vegan.
Interesting.
So, yeah, so yeah, it can be difficult if somebody is out there sabotaging, but you have to focus on yourself. What do you believe is best for you? Right? What you have been doing in the past, if you have weight to lose, if you have this, if you have that condition, it's not working. Whatever you're doing is not working.
Right.
Let's start somewhere.
I'm so glad that you framed it like that, because, I know in recovery, there are people that will say, "Oh, one drink won't hurt." It's like, yes, one drink will. And I've had people say, "Oh, you can have that piece of chocolate just because it has milk in it." And it's like, nah, or you can have that pizza, a little bit of cheese won't hurt. It's like, you don't get it. It's like, I just don't want it. It's not where I'm at. So I'm curious with you, Peggy, your own health. Did anything change? Was there like health reasons why you decided to go plant-based? And if so, what was the before and after like for you?
So I didn't think necessarily that I needed to lose a bunch of weight. I would have been happy with 5 or 10 pounds. I
Mm-hmm.
just couldn't lose. So I lose it, even though I was cycling a lot and I was very active. And I thought, well, whatever, this is the way I'm built. So it wasn't a big deal. But I did have severe arthritis in my knees. But cycling sort of took care of that. It wasn't a big issue. So, but when I heard Dr. Caldwell Esselstyn convinced me that I didn't need meat to be healthy, I thought, you know what? Well, I'll try it.
Mm-hmm.
So I gave up meat. I gave up dairy a couple months later after I read the China study, and Dr. Campbell convinced me that I was giving my kids cancer by giving them all this milk. But I eventually, in a short amount of time, I lost 20 pounds. And then over the years, I mean, it's been 17 years, so I'm not as strong and muscular as I was, but it's been 30 pounds now. 30 pounds I've dropped.
Interesting.
And
Interesting.
I can do the same weights, just about chest press, bench press, leg,
Right.
I'm still as strong. I'm thinner and I'm not as muscular, but I'm still plenty strong.
Well, and that happens with age. I'm 70, and so it's like, things like I don't have the same abilities that I had when I was younger, but I certainly have a lot more than most people my age. I mean, I compare it to that. So I also know that it's based on what I put into my mouth. If I eat 100% whole food, plant-based, my energy is through the roof, my vitality, my focus. If I put that vegan junk food in my body, I feel it. I mean, I actually feel it in my joints. It's amazing how fast the body talks to us when we eat clean. But where do you see the future going for plant-based eating, for the vegan movement? What do you see coming down the road?
I see a lot more products in the
Mm-hmm.
market.
Mm-hmm.
I see. I'm skeptical, but even healthcare is becoming more wellness oriented and preventative, but it's just not fast enough.
Right.
Not fast enough. The reimbursement is just not there, and that's it's just a shame because there's so many people still that think their doctors are the end all and be all.
Right. Right.
And while, yeah, there are plenty of great doctors, there are just some that haven't kept up with the research.
And we can't really blame them because they're under a lot of pressure. But for me, it's like if I see a doctor who's 50 pounds overweight, they're huffing and puffing, and they're trying to tell me how to be healthy, I'll probably change doctors. But now I know that you've got a program, a digital program, and tell us about that and where can people find it? And I think you have a free gift for people too.
I do. So let's go to Five to Thrive first. So that is my 6 week um, online program.
Mm-hmm.
And I teach 5 power moves. So Five to Thrive is about 5 power moves. The 5 things over all these years, during all these years, the 5 things that I've noticed have been most effective for dropping weight, dropping blood sugar numbers, cholesterol, blood pressure, whatever it might be, joint pain, headaches. 5 things, simple 5 things. I don't tell people that they need to give up animal foods,
Mm-hmm.
but when people do these 5 things, animal foods and processed foods, they sort of get squeezed out.
Interesting.
So, and people adapt to that process, I think, better than when back in the day when I was telling people, okay, it's Tuesday night, no more animal products, no more. Certainly I wasn't that
You're
blunt.
cut off. That's it.
I wasn't that blunt, or strict, but yeah, it was more of a lean into this plant-based. So that's what we do. It's 6 weeks program. It's all online. The piece that is so effective, and this is what grew Weight Watchers from 6 women meeting in Gene Nedich's living room to what an $82 million company.
Mm-hmm.
It's the community, it's the support, right? So we meet on Zoom, depending on how many people register, right? All of us, everybody's face. And I do some of the talking. I don't do all the talking. People talk to each other.
Mm-hmm. Mm-hmm.
Do this. I did this. Oh yeah, you did it. So plus during the times that we're not meeting on Zoom, I have a private discussion room, and it is so lively. People post. They post. I encourage people to go in there every day and post about what they did today.
Right.
Even if it's just a line, or people love to read it. Post pictures of your food, of yourself, whatever.
I love it. I love
Yeah,
it. Now, where can people find that program? Where can they go to get the program and sign up for it?
So you can go to peggykraus.com,
Mhm.
and right there on my homepage is the registration option,
Perfect.
more information and registration for the next round that starts September 25th.
Okay.
Right, so
Sounds great.
it's coming right up. So that is Five to Thrive, and I had great results so far. But
How often do you offer that class?
I do 3 times a year, 3 or 4 times a
Okay,
year.
perfect. So if somebody doesn't get the September one, now what if they heard this after the start of the class? Can they reach out to you and possibly get private coaching? Is that possible?
I'm not doing much private coaching
Okay,
these days. I'm concentrating on Five to Thrive. I've
perfect.
I've created I call it the Thrive Challenges, which is sort of I don't want to call it a maintenance program, but really that's what it is. It's sort of like every 6 weeks there's a challenge. And we just finished the summer challenge, which is soups and salads. So we met on Zoom, then 10 days went by while I was encouraging people to eat more salads, more summer foods. And then we finished on Zoom. And all that time, there was the discussion room open. So, but every 6 weeks, there's another challenge. So people
Perfect.
can't fall too far away because here I am. I'm coming back with my wellness wagon. I'll pick you back up and let's meet again as a group. So,
Perfect. Well, I do have a question. You just sparked a question in my mind when you said
yeah.
that, every 6 weeks you or 3 times a year. And if they're starting in summer, I'm sure that the meals that people prepare and they put pictures of are different than what you would see in the winter. Because myself, I love the crock pot. Like crock pot is my best friend. I did a beautiful curry dish yesterday, and today I'm going to do a pinto bean soup. And so I would imagine in the winter, you have more stews, you have more soups, you have more things like that that are all void of animal and dairy. Am I correct?
That's right.
Boy,
That's
I'm
right.
getting excited about this. I'm going to have to check out your program. That's awesome. Now, what about the free gift that you have for people?
Okay. So I gave a workshop earlier this year and I called it, I wanted to uh, let people see that there is an alternative to what we're sort of spoon fed. So the program's called Take Your Numbers from Acceptable to Exceptional.
Ooh,
So it's based on the fact that when you have lab work done and your doctor says, "Oh, your cholesterol is 196," that's okay, that's fine, and your blood, your A1C is 5.6, that's fine, that's not diabetes. You're good to go. Just keep doing what you're doing. That's so not right
right.
because 35% of people who have heart attacks have what we call desirable, less than 200 cholesterol, total cholesterol. So that means that person, if that my doctor told me that my cholesterol is 196 or even 170, I still have a 35% chance of having a heart attack. 1 in 3 people with a cholesterol level under 200 are going to have a heart attack. Do I want to be 1 in 3? No. And I want people to know that they are not protected by following the national guidelines. So in the program, I sort of tease out. I focus cholesterol and blood sugar, but I tease out what is okay and what really is not okay and what
Mhm.
to strive for. Yeah, I think that somebody needs to be honest and say, well, it might not be easy to get to this range with diet and exercise and without medication, but this is where you're going to be protected. This is where you're going to be heart
Right,
attack proof. And
right.
I'll let you be just the make the decision on how compliant you want to be with how you're going to get there. So I can say that to be heart attack proof, you need to do this, this, and this. And you can say, you know what? I can do this and that, but I can't do
Right,
this.
right.
Well, then, that's fine. Let's do what you can do and let's see what happens. But I think that somebody should tell people what the numbers really should be.
Absolutely. And that's why you being on shows like this is so important, because you've got an important message to share with people. And, it's not coming from the person in the white coat that, is 100 pounds overweight or 50 pounds overweight saying, this is what you need to do. I'm not going to do it, but you need to do it. So I really appreciate that. Now, where can they find this free gift?
So if they go to my website, so it's peggykraus.com
Mhm.
/exceptional.
Exceptional. Okay. And we'll make sure to put that in the show notes. And, I just really want to encourage people. You may want to listen to this again because Peggy, you dropped so much great information. And to me, I look at what's going on with the politics, with healthcare, with the FDA, all of that. The FDA gets 45% of the funding from the very companies that they approve the drugs on. Come on, do your research and find out what's really going on. But it's frightening when you think how broken our healthcare system is. And this is my opinion. This is not, Peggy's opinion. This is my opinion. This is the research I've done. It frightens me to think that, there's acute care and there's chronic care. And with acute care, it's like I broke my wrist a few years ago, had to go have emergency surgery. That was one situation. But as far as chronic illnesses, I'm going to do everything I can to prevent it, because I don't want to be at the mercy of a system that is so broken that it's really about profits over people. So Peggy, thank you so much for what you're doing. And in closing, what are your final thoughts for people?
I would say learn about what is going to fix your problem. Don't worry. Don't learn. You don't want to know about a Band-Aid.
Right.
A lot of those drugs, a lot of those procedures are Band-Aids, right? We'll figure out what's going to fix. Why do you have high blood pressure, high cholesterol, high blood sugar, and then work on that. Even if you're not ready to dedicate 100% of what it's going to take to fix that, at least you'll know what's causing it, and you can stop throwing matches on the fire.
Right.
So be your own advocate, do your research, listen up, and don't stop until you get the answer that you're looking for.
Outstanding. Well, Peggy, this has been delightful, and I encourage people, go visit Peggy's website. Go to peggykraus.com. That's peggykraus.com. We'll have that in the show notes, and check out the gift that she has for you. And take responsibility for your own health, because I can assure you there are people that don't care if you're healthy, and there are others that truly do care. People like Peggy, people like myself. We want to do what we can to make the world a better place. This is Kathleen Gage, host of the Plant-Based Eating for Health podcast show. Thank you for tuning in, and go out, live consciously, and think about every bite that you put in your mouth. Have a great day.
Thanks, Kathleen.
You've been listening to the Plant-Based Eating for Health podcast show. I'm your host, Kathleen Gage, inviting you to subscribe to this channel wherever you're listening or watching the show. And please let your friends know about the Plant-Based Eating for Health podcast show. Live healthy.